My name is Zoe Bailey. I'm curriculum leader for health and sport at the college. So the idea of this afternoon is just to provide you with a little bit of information, give you the opportunity to ask some questions about potentially doing health and social care next year. I would assume that most people who have joined this afternoon have already decided that it's health and social care that they want to do. But again, if there's anybody new out there that thinks that they might like to try it, and I've got some other questions in addition to what I'm going to say on the presentation, then please feel free to ask at the end, or you can email admissions as well. So health and social care, obviously a very popular course. We're a really big department. We've got lots of staff across the 2 campuses delivering on health and social care. We're offering the level 3 courses as well as some level 2 courses in health and social care. And we deliver those courses both at the University Road campus and at the Regent Road campus. We've got 3 different levels of courses for the level 3. So we've got the extended certificate, the diploma and the extended diploma, and they are all worth different amounts in terms of time. So an extended certificate is the same as 1 A-level, a diploma is the same as 2 A-levels, and the extended diploma is the same as 3. With the level 2 health and social care, we offer an extended certificate and a diploma, which are the equivalent to GCSEs. So if you came to open day, you may have been lucky enough to have a chat with some of our staff. And again, if you were invited in for interview, again, you would have been able to have a talk with some of the staff. Just to really summarise what the courses are about, obviously the Cambridge Technicals are more of a vocational route, which means that there is a lot more emphasis on the workplace and the skills needed in the workplace. And as well as you learning theory in the classroom, that you're expected to be able to apply that theory, whether it be through coursework, in exams, or in practical work experience situations. So if we look at the extended certificate first, so that's the equivalent of 1 A-level. In this particular course, you'll do 2 exams in your first year and 1 exam in your second year. The 2 exams in your first year are on equality, diversity and rights and health, safety and security. And in the second year, anatomy and physiology. So just to make you aware that there is a little bit of science in there. It's not particularly easy, but the staff will work with you very closely to make sure that you feel comfortable with the material. We discuss lots of difficult topics, so need to be perhaps prepared for that. But again, it's always done in a very sensitive way and obviously applicable to the workplace. Obviously, at the moment, with our current healthcare situation in this country, health and social care has become even more important. So we'll be looking at some of the skills involved in some of the jobs in our society at the moment. If you decide that actually health and social care is something you really want to do, you might opt for the diploma or the extended diploma. The diploma is the equivalent of 2 A-levels, so you would study another course alongside that in order to make up a full-time programme. In addition to the unit studied for the extended certificate, you would do all of those plus the ones listed in the green box there. So infection control, safeguarding, supporting people with learning disabilities, promoting positive behaviour and principles of youth work. So there's an additional exam in the diploma compared to the extended diploma, which is in unit 7, which is safeguarding. As well as doing the exams and the coursework units, you'll also do a 1 week's work experience both in your first year and your second year, so you would need to be prepared to find a placement for that work experience, and obviously we'd prefer if that work experience was done in a health and social care environment so that you can apply some of the skills that you've learnt. It's also useful because some of the skills that you learn in work experience can also be used in your coursework and in some cases can be essential. The extended diploma then, they're over there in the blue, that's the equivalent of 3 A-levels. So if you're opting for that choice, it's really because you've decided that health and social care is what you want to do, and you're putting all your eggs in one basket. To help aid you with that, knowing that health and social care is your career, we're going to do 1 day a week work experience. So you'd spend 4 days a week in college and 1 day a week out in work experience. Our careers team are very good at helping people to find placements. Some of you might know about places where you'd like to go already, or areas you'd like to work in, and they'll be helping you to find your work placement. So again, like the other courses, you would study all the units from the extended certificate and the diploma, and in addition you'd look at psychology, caring for older people, creativity and activity for adults, sociology and research methods. And you can see from the bottom there, again, there's an additional exam, and that is Unit 25, which is research methods. So it's a fully committed course. It requires you to be organised, meet deadlines, be good at projects, be interested in doing the best that you can do, being interested in applying what you're learning in the classroom to the real world. So we'll study in lots of different ways. There is a lot of classroom-based learning, and there will be access to college IT, but we try where we can to bring the subject alive. So we'll have visiting speakers in, we'll have trips and visits. We'll try to learn by doing practical things, like maybe moving and handling older people, or looking at policies and strategies that exist from government to try and support people who work either within healthcare or use those services. Like I've already said, external exams and coursework. And when we do coursework, it will be a variety of things. So it might be written reports, it might be looking at video analysis, it might be looking at your practical performance when you're working with clients, interviews, or particular social experiments, for example, in sociology to do with communication. We do offer you as much support as we possibly can, but like with all vocationals, we can't write your assignments for you. That's something that you have to do. We'll support you and we'll give you feedback, but it's up to you to produce those assignments. So, because remember, you're being regularly assessed, you're being assessed unit by unit. So you should know exactly where you are on the course as you move through towards the end. Okay, there is the opportunity to study at level 2. So some of you listening might know that that's where you're wanting to study, and obviously our commitment to you as studying at level 2 is that we really want you to progress to level 3 study. So that means that you would need to do really well on your level 2 programme, achieving distinctions in order to move on to level 3 to show that you have the skills to be able to do that. And I've just listed there some of the units that you might be thinking of. So no matter what academic program you do, whether it's the 1A level, 2A level or 3A level equivalent, you will also be looking at doing some enrichment, and some of the things that might interest you and might link with your health course might be things like sport and physical activity, or it could be looking at alternative things like performance music, art and craft, or you might be interested in doing a little bit more volunteering, or even looking at languages. So that will be an additional option on top of your academic programme. So that was just a little overview. So really, we're looking to you now to see if you've got any questions that you'd like to ask. This could be about the programme, it could be about the college, timetable, the different campuses, anything you like. Fire away. Everybody seems very quiet this afternoon on the Q&A. I think it's because of the sunshine. Everybody wants to get back out into the sun. So your typical timetable, I'll give you a little bit of a rundown of your day. Your typical college day would start around about 9 o'clock in the morning, and you finish at 4:10. Obviously, if you weren't timetabled to be in those first blocks or those last blocks, you'd be allowed to leave. You don't have to be on campus the whole time. Obviously, if you end up with a study period or a free period during the day, we'd expect you to use that productively. So using the study centre or the library facilities or IT facilities that exist.
We've got a question.
Okay.
It's from Rachel, and she says, what courses go well with health and social care, and what would you advise us to be going through right now?
Okay, so lots of things go well with health and social care because there are so many skills involved. Sometimes we find that people who are really interested in the sort of sciencey side of health and social care will often link it with a science, or they'll perhaps traditionally link it with something like sociology or psychology, or any of the traditional subjects like history, geography, English, which allow you to develop generic skills. It really depends on you as a person and where you think you're most likely to be successful. So you've got to remember you're going to spend 2 years doing these courses. So you've got to combine it with something that you feel you're going to enjoy and therefore going to be successful at. The other thing you can perhaps think about is, if you've got a career in mind, is to go onto some university websites, look at the courses and look at their requirements for their courses. So they may just specify 3 A levels, they may just, or equivalent, they may specify something that's health related, or they may specify a specific subject. So it would be worth doing a little bit of extra research just to check that you're heading in the right direction. As for now, in terms of what you can be doing now, on the college website, there are some links to some tasks to help you prepare for the level 3 study starting in September.
Okay. Would health and social be good for someone wanting to do occupational therapy in university?
Yeah, definitely. You learn lots of generic skills, and especially the skills like communication, working with patients, all those sorts of things, or clients, are very important. It would also be good because you're also going to develop skills through work experience. It's a generally recognised qualification for somebody who's moving in that direction.
Okay. I've chosen health and social care extended diploma. Would that still get me into midwifery in the future?
It would do. Midwifery is very difficult to get into. It would do, but you'd need the top grade. So you'd need to be looking at a distinction or distinction star. So heading in those sort of directions. And as I say, once you get into college, we've got a really good careers team. So it'd be worth going and having a chat with them because things like work experience will be essential. So if you were able to manage in your first year or your second year to get some work experience in those sorts of areas, that would help your application.
That's it for the questions for now. We can wait. If anyone's got any more, please feel free to send them through and we'll answer them.
If you feel like you don't want to ask any questions now on the webinar, then obviously you're free to email admissions. So that's admissions@wqe.ac.uk and they'll pass them on to me and the team to answer later on.
Oh, questions just come through.
Okay.
What is the most difficult part of health and social care?
I think there's a couple of difficult parts, actually. I think there's one part is from an organisation point of view. I think coming from school, school tends to keep you very organised. When you come to college, we're kind of expecting you to do a little bit of that independently. And I think the juggling act of sort of doing coursework, submitting new work, redrafting old work, being organised in that sort of way is sometimes quite difficult. In terms of units, I think quite a lot of students will probably say that the Unit 4 Anatomy and Physiology unit is the harder one, and that's the science-based one, and you sit an external exam in that. So there's lots of things we do to try and make that unit easier. So we tend to look at the body systems separately and then link them to physical conditions and long-term conditions that people suffer from. So it sounds scary. It's honestly not as scary as it is, but I think students will probably say it's the Unit 4 that's the most difficult.
Okay. Oh. I originally applied on PS16 for biology, chemistry and health and social care. Do you think it's possible to do all three?
Yeah, it is possible. I mean, you've got two traditional subjects there that are exam based. The coursework that you do in those subjects will be limited to certain points in the year where you'll be doing sort of practical experiments and write-ups and research, whereas your health and social care coursework and exams will run throughout the duration of the course. So yeah, it's definitely possible, and it's not an unusual combination to mix the sciences with the health and social care. Just like any other student, you just got to keep yourself organised, use your time effectively.
Okay. I believe that's it for now. So.
Okay, well, like we said, if you do think of anything else you'd like to ask, then please email admissions, and you can find all the details on the website. I hope you have a lovely summer, and look forward to seeing you in the new academic year. So good luck and stay safe.
Thank you for watching, everyone.
Bye.